What would you do if you saw somebody collapse and become unconscious immediately? Hello, my name is Rhett Miller, and today I will be demonstrating the process of CPR and the use of an AED. Even though you might know to call 911, starting chest compressions on the victim can almost double their chance of survival. Hands-only CPR is now a recommended way of doing CPR rather than traditional CPR. In the videos I've watched, researchers such as Dr. Ewey and Dr. Kern from the University of Arizona Cyber Heart Center has shown that hands-only CPR has increased the risk of survival tremendously. The props that I have here today that I will be using are my AED machine here, my CPR dummy here, which is a pillow and a stuffed animal for the head, and these are what I will be using to complete my demonstration. Step 1 of CPR is to check for responsiveness. Shake the victim repeatedly and shout, "Are you okay?" If unresponsive, tell somebody around you to call 911 immediately. However, if you are by yourself, call 911 and put them on speaker. Provide dispatcher with details and begin CPR. Lay the person on their back and move up next to their head/shoulders. Are you okay? There was no response. So, next you need to tell somebody to call 911. You, call 911. Step 2 of CPR is to begin CPR. Position yourself with your elbows straight and in a locked position. Put your hands on top of the other in the center of the victim's chest. Give the victim 30 rapid chest compressions at depth of at least 2 inches at a rate of 100 beats per minute. After each compression, let the chest completely rise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 28, 29, 30. Step 3, after you've completed the 30 rapid chest compressions, is to tilt the victim's head and lift up their chin. Give the victim 2 rescue breaths, each lasting at least 1 second. Once you've given the breaths, step 4 is to continue giving a cycle of 30 compressions to 2 rescue breaths until one of the following happens. The person wakes up, there is an AED brought to the scene, or medical professionals show up and take over. A few things to note when you are performing CPR is to keep giving the compressions even if the victim is gasping. Do not check for a pulse, clear the airway, or perform mouth-to-mouth. All of these things pause CPR and lower the chance of survival. Now, if an AED is available, these are what you should do. If there is an AED available, using it increases the chances of the victim's survival. The AED works by delivering a shock to the victim in order for the person's heart to start pumping again and to get oxygen to the brain. Sometimes an AED shot does the job and is able to bring the victim back. However, other times, compressions are needed to help revive the individual. Command somebody around you to go find an AED if there is one near. You, go get AED. Once the AED is brought to you, place it beside your victim and open it. Once you turn it on, there will be audio instructions. Follow what it says. It should tell you to remove the clothing from the person's chest and make sure that their chest is dry. As so. Next, attach the AED pad to the person. One pad just below the right clavicle and the other pad just below the left breast, as shown as the diagram. If needed, plug in the connector. Take your pads and place them where they should be. The pads will decide if a shock is necessary. If called for, clear the way of the victim and make sure nobody is near. Having somebody near the victim during a shock can be dangerous. Once you've made sure everybody is clear, press the orange shock button on the bottom of the AED machine and it will deliver a shock to the patient. Everybody stay clear. Applying shock. Once the shock has been applied, resume chest compressions until the paramedics arrive, regardless if the AED delivers a shock or not. The process of CPR has changed in many ways over the years. Hands-only CPR and using AED machines have been proven more effective by medical professionals. There is not always access to an AED machine, so if there is no access, you should continue compressions until medical professionals arrive or your person becomes conscious. If there is when medical professionals arrive, you should stand back and let them take over. If there is an AED machine, you should utilize the use of it. Almost every minute, somebody dies from cardiac arrest. Cardiac arrest is one of the leading causes of death worldwide. Although with proper training and learning the steps, you can learn the process of CPR. Who knows, maybe one day you will have to put your CPR skills to the test. Will you be able to save somebody?